Well, good evening, everyone. Happy May to you, and thank you for joining us on what is our 6th week of sheltering in place and conducting our Health at Home series. I'm Andrew Asato, the Executive Director of Susan G. Komen for Oregon and Southwest Washington. And tonight, we're going to take a journey to the South Central Oregon coast to talk about cancer care in rural communities during the COVID-19 pandemic. And it is such a pleasure for me to have someone join us, a friend and colleague, Barbara Van Slyke, who's an oncology nurse navigator at the Bay Area Cancer Center in Coos Bay, and over the years, traveling across Oregon and Southwest Washington, along with Cindy Fletcher, our program director, who many of you viewing tonight know. We've been so fortunate to learn about the amazing work that medical professionals are doing in communities all across the state of Oregon and Southwest Washington. So welcome, Barb, if I may, for joining us from Coos Bay, from your home.
Hello. Hi.
So Barb and I have
glad to be here.
Thank you. So Barb, we've had a pleasure to visit with Barb several times and learn what she's doing in rural Oregon. And so we asked her to join us tonight to explore this a little further, because as Barb, you and I know, most of the Pacific Northwest people reside in rural communities, and there are unique challenges to providing medical care when you don't live 5 miles from your medical center, or you have to travel several miles, if not hundreds of miles, to receive specific types of treatment. So I guess, and I want to share with our listeners and viewers, if you're new to us, that we are taking questions. So as I am speaking with Barb, we will entertain those questions on the second half of this program. But before we do so, Barb, can you talk about how the approach to care has changed and evolved in your cancer center since March, when the state began the stay home, stay safe measures?
Sure. I am guessing that we went through the same changes that everybody's already aware of all of a sudden one day nobody else can come into the cancer center with the patient, so the loved one couldn't come in anymore. And there's a wash station right in before you walk in, and a person who stands there in temperature. And I think this is probably everybody's experienced that and understands that. Everybody's masked and gloved. Of course, the staff is all masked and gloved, or not gloved, but masked all the time, and patients too. But I think just that barrier, that closing, that the people are leaving their loved one sitting in the car. The loved one is probably sitting there and sometimes they might be in with us for, you go to the doctor, sometimes you have to wait to be seen, and then you're seen, and then maybe for an hour and a half, and the whole time they're curious of what's going on, what's happening, what are they saying to my spouse. And so those changes, I think they're probably the same in the urban world. I can't really speak to what's different in the rural world to the urban and that kind of thing, but just those physical barriers and boundaries and protocols. And we're several weeks at the beginning. It literally changed, every other day it was another new thing, and now this changed, and now this barrier, and just layer after layer happened. So first of all, it was just keeping up with what was going on and the confusion, and I think that was a little difficult for the patients, because they would want us to be the solid what's going on. I remember one time I was just walking through the lobby to go in to talk with the doctor, and this patient saw young stage 4 metastatic breast woman in her early 30s, and she saw me and she just started sobbing because she said, I have to get my treatment. That you can't close down, because the huge clinic, the medical clinic had just closed down the day before. And so the fear and the fact that it was a moving target, every day was a moving target. And I of course I told her that's not going to happen. Cancer care is definitely essential. We understand that. But honestly, in the back of my mind, the whole time I was comforting her and supporting her, trying to lift her up and bring her hope and sort of almost back to reality a little bit. In the back of my mind, I was also thinking, do I really know what's going to happen in the future? I hope I'm not telling her a lie that we're never going to close down. I think that it's probably a little different if we're able to really speak from what we know is the truth of what's happening, and the myth, and just changing day to day. But at the same time, everybody's going through it in the world. So everybody's uncertain. But I think I can't imagine having a cancer diagnosis at the same time of this going on. And it just, that first week or two was mostly dealing with incredible anxiety and fear at the same time that you're dealing with it yourself, you know, and what's happening. Other things, of course, that have changed is your meetings with your colleagues in oncology. We have 3 or 4, department meetings every week, because the caseload is so complex that we have to all be talking all the time. And like everybody else, they're all done, this way, or maybe, just a couple people in a room, but we have 3 rooms. So the rooms are all tied together. But I personally just really miss that sharing of that team spirit, and that, and and there's a lot of things that happen, after the meeting that you clarify or you work out with somebody and that kind of thing, and maybe negotiate even. So I personally kind of miss that, and I can't wait until we can just get back together and meet as a big support, one big team again, kind of a thing. I meant a little bit about the patient's family sitting outside in their cars now, and so communication has really been affected. And my role as a navigator, one of the things, a lot of my stuff that I used to work on, maybe working on programs that I'm working on, or projects and stuff, those things have kind of gone by the wayside. And the things that I've picked up more is literally being in the doctor's office with the patient for their visit, maybe having the patient's family on the phone, or if that doesn't happen, I'm taking notes, writing notes in English, human speak, instead of just what the physician's saying, so that at the end of their visit, they have a 2 or 3 page summary of what happened that they can take back to their loved one. And well, that's a lot of my time right there, I think, is just communication and trying to support in other interesting ways. I kind of think about the, how's it changed in nursing. And last week I was standing out in the rain with an umbrella, mask on, umbrella, a couple feet from the car door of the loved one, because I wanted to be able to talk to her in person about the seriousness of what was going on. So that to me is like, that's the new nurse in the outpatient setting, is taking up, and now it's not just what's happening treatment course or treatment plan wise, but the support, the emotional support of this person who, if you're telling them we're going to have to put your husband in the hospital and you can't go in with him, and it's, it's very serious. And so supporting someone in that method is just, it's good for your nurse when you're it's good for your heart when you're a nurse to be able to do those kind of things, but it also is very wearing on you too, to have to see the suffering that's happened because of COVID of people.
I know, having visited your center on more than one occasion, how that collaboration is so important, that community-based care, and how closely you all work together, and how difficult that must be. One other thing that we have talked about in the past is the challenge of geography. And well, in Coos Bay, you're serving patients from up and down the coast and inland. And on kind of a 2-point question, what would you say on average is how far your patients are traveling for appointments, and how are you utilizing telemedicine more when it makes sense to do so?
Our patients are from north of us about an hour, and inland, depending on, probably an hour to an hour and a half, and then south up to 2 hours. So it's a catchment area of several hundred miles. And so that always has its challenges for sure. But it hasn't been simpler by the changes and the restrictions to travel. One of the first things that even clued me in that something was weird going on was the transportation just stopped. It was like, and I was like, what's going on? How come the transportation isn't happening more? And they were one of the first ones to say, we're shutting down and not transporting people anymore. So it's always a problem. You think about oncology has a lot of elderly people, and a lot of them don't drive. A lot of them don't drive after dark. A lot of them driving up 200 miles, 2 hours, and then back home 2 hours is really hard for them. And they rely on transportation, and when it's not there, it's a struggle. So it's still a struggle.
For your breast cancer patients that you serve, are they able to get all the care they need in Coos Bay, and if not, where do they go? Where do they need to travel to?
Most of the time, I'd say 90% of the time when they go somewhere else, it's Portland, generally OHSU. We're in the network with them, and so we have a very close relationship with them. Some people go to Eugene, but most of, like I said, to Portland. What has changed now is some patients who were maybe going to get their breast reconstruction surgery done up there or something decided not to because they were unsure of they felt like the city might be less safe for being around COVID as down here. Or they went up there. I had one young mom who was up there calling me, and she said, I just got out of my breast surgeon appointment, and she sent me over to the reconstruction. But there's no hotels, they're closed. There's not even hotels open. Mm-hmm. And we don't even, I think we're just going to get the surgery down there because we can't, how do I deal with my family? And where would they, it was like a logistics issue happening there. The other thing is that the consultation services, you have the subspecialties of oncology, those are done in doctor's offices, but up in Portland. So it's just like here, the doctor's offices, a lot of them are closed. They're not. So our consultations that we send other places to get recommendations, second opinions, those kind of things are not, honestly, they're not happening. So people are not happening. So they're staying down here for that instead of doing those things that they would do. Yeah.
Well, you just noted, even in normal times, traveling to Portland, much less, even to Eugene is a long drive from Coos Bay. We know that, having done that, and your patients know, and you've kind of answered this question because, there's no hotels open, or do they want to come to Portland where there's a higher infection rate? And then you have issues of transportation on the coast. Are there other pandemic-related challenges that are unique to the rural communities that you're experiencing, or coastal communities that you're experiencing at this time beyond that?
Let me think. Lodging's always an issue. A lot of what a navigator does is it's case management. So a lot of what I do is work with the social services organizations in the community. And some of those social services agencies, a lot of them are small, have literally closed. They are closed. They're not there anymore. So like the multifamily specialists that I would work with to try to find housing for, a woman with kids, that little chunk of that agency is gone. So I don't think we've seen all the far-reaching, and then, like I told you, reorganizations of bigger things like American Cancer Society. I think some of that fallout is just kind of starting to trickle in. Housing is real housing, like housing authority with the state. All that's just been put on a stop for several weeks now. And if and when it restarts back up, especially because so many of those things are related to budget. And we all know that everybody's budget is going to be really impacted. So those services that help help people get through something like an oncology diagnosis, I really fear for what's going to happen with that. As a community, as a small community. Go ahead.
Oh, if you're just joining us, I want to share that we're speaking with oncology nurse navigator Barbara Van Slyke from the Bay Area Cancer Center in Coos Bay, and we're so glad to have you. And again, we are taking questions that Barb would be happy to answer if you go ahead and log those in. I have just another question or two for Barb, and then we'd be happy to take your comments or questions. So thank you again for joining us. Barb, as a nurse navigator, you've already talked about challenges that you're facing that are very real for your patients that you serve and for you as a caregiver. What is your top challenge during this time, if you had to single that out? Or is that a fair question to even ask you?
Initially, I think it was emotional. That was all encompassing, the emotional and uncertainty, and just trying to contact and be in contact with people a lot about just being in contacting them and telling them where we're at now, and so that they know that the plan is still being worked on. They're still in planning. Irradiation is still in planning. This is happening, and find out what kind of needs and specialties, kind of needs they have. Then I think some of it was just the getting stuff reworked in our own world, like our cancer support groups stopped meeting. So in a time when you need them most, the clinics closed. That's where the counseling, that's where the LCSW were. So the time when we needed people for their emotional things, we didn't really have a lot to refer them to. Those things are our support groups like this, we're going to be doing it on, on the web now. So, and then some of the services are starting to open up. But today I called the hotels to see if they were open up yet, and they've opened up. But even now, even lodging, because people have to come here and stay. Like if you are going to get two things done, your PET scan on one day and then your treatment the next day or something like that, and you live, on the California border, you like to stay up here. So that wasn't an option for a long time. Like I said, all the small amount of transportation we had was gone. Another thing that is, I'm just quite fearful about is that, we fundraise for our patients too. Cancer Center, we fundraise to get a fund, the Cancer Patient Assistance Fund, and our fundraiser was canceled this year. So that's how we take care of a lot of people, is that way. And I just wanted to put a plug into Komen right now, because as you know, I use Komen a lot. It is literally my favorite nonprofit out there, because they're just fabulous to work with. It's so easy. And what I want to say is that although Komen is for breast cancer patients, the fact that you guys spend thousands of dollars every year on just my little pocket of patients, that frees me up that thousands of dollars to use on other patients. Do you see what I'm saying? That aren't breast cancer. So even though you're for breast cancer patients, you actually serve all cancer patients by doing that. It's just one of those ripples that happens from your good work. So I'm ecstatic that you increased your program to help out not just the people that live 25 miles or more away, but also just people that are struggling right now. And it's really appreciated, the people I've talked to, that I can just, it kind of seems unfair that I get to experience the happiness from the person, and you guys are the one, all I'm doing is out in the face-to-face with the people that receive it.
Well, we want to thank you because when the pandemic began, we conducted a survey with nurse navigators and community health workers around the state, and you helped guide us on what's the new normal, what is the need? Is it groceries, electricity, and how could we, is it not about travel anymore? You might live 5 miles from your hospital or cancer center, but you've lost your job or your insurance or your spouse did. So we're so grateful to have that feedback from you to help us modify the program, the treatment access program, which we use to provide gas, food, lodging, groceries, other things around the state. And I know how hard you work in Coos Bay with your own fundraising to do that as well for all patients. But that your point's well taken that while we help breast cancer patients, it does free up your resources for others. So I really appreciate that, and appreciate you helping us guide this program during this unprecedented time. I want to, before we go to questions that might be queued up, through all of this, what might be a highlight that comes out of this, if that's even, it's a hard thing to think about, but with difficult times come good things that we learn. And is there something that you think might be a highlight that will produce itself in the continuum of care for breast cancer patients and all cancer patients?
I think there will be, I'm a cup half full kind of person. So I have a great imagination. So I can see some really good pieces of technology that we're going to take. I mean, being able to do this kind of a assessment with your patient who now doesn't have, transportation's not an issue anymore because now they don't have to drive up here, 100 miles to get here. So those things I think will pull forward and at least maybe have that option for our patients that don't necessarily have to be seen physically. So I think there's going to be all kinds of, the other thing is, I was talking with a patient today and I said, well, don't you kind of feel a little bit happy or justified that now everybody kind of has to feel what it's like to be a cancer patient, to worry about germs. And, it's kind of like being on neutropenic precautions the whole time. And now everybody kind of has to kind of walk in your shoes and see what is this like, and this is what your life is like, COVID or non-COVID. This is your fears, and not just that they maybe understand, oh, that's why that person has a mask on, but maybe as a nation we'll be more will ingrain or adopt some behaviors that are going to be more healthy as far as germs. So
I hope
so that's a positive thing. I hope so. The other thing I think is just, in the face of any adversity that's going on, your colleagues, your staff, your team members, you tend to grow, you go through, it's a hassle. And I'm the first one to admit it. There's weeks when we, at the end, by Friday, we all get together and we say, I'm sorry, I was more short-tempered this week. And, we feel like but we all sort of forgive each other because the anxiety is just so intense and so high that we know we're snapping at each other more. But the fact that we're all kind of like siblings and we can say that, I feel like as a team, this adversity is going to only make you stronger and more enjoined together emotionally, and you'll have this history together. So that's a bonding kind of thing, and that's a highlight to me always, is sort of loving after each other making sure you go tell that person, put a note on their desk that says, hey, so-and-so said this awesome thing about you today. You know, like you just feel like you kind of almost need to do that more. So I don't know. I think all of the emotions of America is a tiny bit raw, and that's a good thing, because there's nothing wrong with feeling your emotions a little bit and bringing you into reality of living in the moment and what the present means, and kindness and all those things. I mean, they all are intertwined together. So, you know, I think there's lots of mini highlights. They're not glaring, but they're there. They're there.
I think you have to find them in times like these, and certainly we're all going through some level of a shared experience, although different on levels for folks. But I want to thank you for spending your time, your evening with us. And I would like to turn it over now to any comments or questions that have come up during this conversation. So Alice, if you have any, do you want to share those?
Yes, we have had a few come through. The first question we have is, are there any virtual visits we can do online so that we don't have to travel to major cities?
Yes. Well, I mean, I think if the question is virtual visits with providers, health providers, yes, I would just say contact that physician's office. And because even the physician's offices here did set those up as well. So I would try that first. If they're talking about, you know, bigger societies or websites of maybe leukemia, lymphoma, that kind of thing, a lot of those also have virtual support groups or classes. Or, I mean, there's a lot of classes right now. There's a lot of free yoga classes or free nutrition classes or there's a lot of that stuff out there. And I'm happy to, if someone wants to ask me exactly what they're interested in, I'm happy to. I don't know if you could do that or not. I'm happy to share whatever, find out. I'm happy to help them figure out what they're exactly looking for, because there is a lot of that out there, believe me. Integrative medicine, all the way from integrative medicine to, you know, like I said, free yoga, free exercise, free everything. So.
Fantastic, thank you. Our next question says, if someone is truly worried about their breast health right now, can they do a checkup over video to determine whether it's something that should be examined further immediately?
Well, unfortunately, video is not going to work on that, because it's really the clinical exam that provider who has so much years of experience in knowing what they're feeling and looking at. And that's really what is needed. One thing you could possibly do is, if it's doable in your area, because I'm not sure that the person posing the question what their situation is, but if they haven't got a mammogram, they could possibly still get that set up, just maybe by a call to their primary care provider ordering that. But if they're suspicious that there's something else happening, they really need that clinical hands-on exam. Yeah.
Our next question says, what are you recommending to people who can't access treatment right now or who are struggling to access treatment?
Yeah, it's true. Because perhaps they don't even have a primary care provider yet, or they've moved, or for some reason so they don't even have a way to get in. And if you don't know your community, you don't know who to call and ask to. If you call any of the many medical centers, like the physician's offices where there's the clinic with a lot of physicians there, a lot of them now have their own case managers, our own group of case managers. It was like one of the best things they started implementing. And it's really only been in the past couple of years, so I won't say they all have it. But if you can get a hold of who that is and talk to that person, they would be able to help you with resources. If you have a cancer center, you can call and ask for the social worker or the navigator if they have that. If nothing else, you could probably even just call your, even your adults and people with disabilities state and just talk to tell the person there what you're looking for. Because those people, like the area agency on aging people, all those people have all the resources that we all have, and they can help guide you. Just need to, I don't know the size of the area that you're at, what you have, but I guarantee somebody there knows the resources of the area or who to send you to. Just keep asking.
I would also add to the viewer's question and others that to Barb's point, you also can visit KomenOregon.org. It's KOMEN Oregon.org, one word, or you can call 1-800-404-8241. And we have a pretty comprehensive list of resources, whether you're in an urban or rural community, that you can find links to, and you can certainly contact us as well. There is certainly information too about our treatment access program that Barb referenced and what she uses for patients, helping them get access to treatment when there's financial barriers. So I just wanted to put that out there now instead of later because of the question that was posed.
We had one more question come in, and then we'll be able to wrap this up. This is a good question for both of you, actually. It says, how great is the need for treatment access right now?
Well, can I start with that, Barb?
Mm-hmm.
I can tell you from our treatment access
Yes.
program, in the past month, as we've opened up some of the parameters of how we deliver this service, we've seen a doubling of the need in a 1 month period. And so that tells us that there is a tremendous amount of financial need just for patients in care to get the treatment, whether they're going to radiation or doctor's appointment, chemotherapy. There is a need, and we're seeing it as the numbers come in, and we're seeing it as we listen. We know it as we're listening to individuals like Barb and others across the state and here in Portland who are supporting patients. And so it's really an urgent lifeline at this time that we're at least seeing in our particular program through Susan G. Komen. Barb?
Yeah, I was just gonna add that sometimes it's not even the patient that has made the financial change. Like I have a number of people that, because of COVID, because when you're cancer and immunocompromised people are, as you know, one of the tier of people that are susceptible. So I have a lot of spouses that come in and say, can you write me a letter telling my boss that I can't be at work anymore, because they are so fearful of bringing home to their person. So maybe they were the only ones still working, So yeah, I think it's you can't just look at the person with the cancer to what does that financial toxicity look like. It's also possibly other family members that are no longer able to bring money home, unfortunately.
Thank you both. That's all we have for questions.
Well, Barb, I want to thank you so much for joining us tonight from Coos Bay. And I want to thank each of you who are here tonight for being part of our Health at Home series. We appreciate your feedback. We're continuing this series. We have topics lined up for the next few weeks. In fact, next week, we will be hearing from someone in Southern Oregon who has benefited from our treatment access program. And again, we know that this is a critical need. It's something that we are working extra hard to raise additional funds for, so we can keep this life moving along during this pandemic. And please provide your comments to us. Any additional questions? If there are additional questions or comments, we certainly can pass those on to Barb, who can answer those questions as best she can. But Barb, thank you from the coast. I hope you're enjoying a nice sunset. And to all of us who are on the call, to all of you, safe, be well, and our best wishes to you, your family, and your loved ones in your community.
Thank you.